If you're one of the millions of people taking amlodipine to manage high blood pressure or heart conditions, this video is an absolute must-watch. Amlodipine is a cornerstone medication for heart health, but it comes with critical precautions to ensure it works safely and effectively. Today, we're sharing 12 things you absolutely must not do while taking amlodipine, based on expert medical advice. These mistakes could undermine your treatment or even put your health at risk. From hidden dietary interactions to medication errors and lifestyle pitfalls, we'll cover the essentials to keep you safe. Some of these may surprise you, and others could be dangerous if ignored. Our goal is to empower you with clear, actionable knowledge to optimize your amlodipine therapy. So, grab a notebook, stay with us, and let's dive into these vital precautions. Disclaimer: this video is for educational purposes only and is not a substitute for medical advice. Always consult your healthcare provider for any concerns or emergencies. All information has been thoroughly researched, with source links in the description below. 1. Don't start new medications without doctor's approval. Never take additional prescription medications without consulting your doctor. Amlodipine interacts with 545 known drugs through the cytochrome P453A4 enzyme system, which can cause dangerous changes in drug levels. Combining it with other blood pressure medications like ACE inhibitors, for example, ramipril, lisinopril, ARBs, for example, valsartan, or other calcium channel blockers, for example, diltiazem, can lead to severe hypotension, causing dizziness or fainting. For diabetic patients on aliskiren, combining it with amlodipine and benazepril is typically avoided due to excessive blood pressure drops. Certain antibiotics, clarithromycin, erythromycin, can triple amlodipine levels, while rifampin may reduce its effectiveness by 50%. Antifungals, itraconazole, ketoconazole, HIV medications, hepatitis C antivirals, and anti-epileptics, carbamazepine, phenytoin, also alter amlodipine metabolism. Always check with your doctor or pharmacist before starting any new medication to avoid serious interactions. 2. Don't consume grapefruit or its juice. Avoid grapefruit and grapefruit juice entirely. Grapefruit contains furanocoumarins, for example, bergamotin, dihydroxybergamotin, that inhibit CYP3A4 enzymes in your gut, increasing amlodipine's bioavailability by 15 to 25%. This heightens its blood pressure-lowering effects, raising risks of dizziness, flushing, or headaches. The effect persists for 24 to 72 hours as your body regenerates these enzymes, so even occasional consumption can be problematic. Pink and red grapefruits have higher furanocoumarin levels than white varieties, and fresh grapefruit juice is particularly potent. Processed products may have lower levels but still pose risks. If you experience unusual symptoms after consuming grapefruit, eliminate it from your diet and consult your doctor. 3. Don't use St. John's wort or untested herbal supplements. Herbal supplements may seem safe, but they can be risky with amlodipine. St. John's wort, Hypericum perforatum, is a potent CYP3A4 inducer, reducing amlodipine levels by 25 to 50% within 2 weeks, which can lead to uncontrolled blood pressure. Its effects, driven by hyperforin activating the pregnein X receptor, linger for up to 2 weeks after discontinuation. Other supplements like ginkgo biloba, garlic extract, or hawthorn may affect heart function or interact unpredictably with amlodipine. Since herbal products lack rigorous FDA testing, their safety and interactions are often unknown. Avoid St. John's wort and consult your doctor before using any herbal remedies. 4. Don't overdo alcohol. Alcohol and amlodipine both relax blood vessels, vasodilators, and alcohol also reduces heart contractility, negative inotropic effect. Together, they can cause significant blood pressure drops, especially in the hours after drinking when alcohol levels peak. This is a bigger concern if you take amlodipine in the evening, aligning with peak drug levels. Moderate alcohol isn't banned, but excessive drinking can trigger dizziness, fainting, fatigue, or headaches, particularly when starting or adjusting your dose. If these symptoms occur, stop drinking and consult your doctor. Always monitor your body's response and drink cautiously. 5. Don't ignore serious side effects. Ignoring serious side effects can be life-threatening. Stay alert for worsening chest pain or new chest discomfort, which could signal unstable angina or a heart attack. Seek immediate care. Rapid weight gain, 2 to 3 pounds overnight or 5 pounds in a week, indicating fluid retention from worsening heart failure. Early diuretic treatment can help. Severe allergic reactions like angioedema, swelling of face, lips, tongue, or throat, which can block airways and requires emergency epinephrine. Liver toxicity signs like upper abdominal pain, jaundice, dark urine, or pale stools. Stop amlodipine and get medical help to prevent liver failure. Report these symptoms to your doctor immediately, don't wait. 6. Don't hide medical conditions from your doctor. Never conceal your medical history from your doctor. Full disclosure is crucial for safe amlodipine use. Severe aortic stenosis is a contraindication, as amlodipine's vasodilating effects can dangerously reduce cardiac output. Inform your doctor about heart conditions, heart failure, recent heart attack, arrhythmias, liver or kidney issues, which increase side effect risks. Pregnancy or breastfeeding, as amlodipine's safety is unclear, and it passes into breast milk. Allergies to amlodipine or related drugs. Conditions like lupus, scleroderma, dehydration, or diabetes, especially with aliskiren. Honesty ensures your treatment is tailored and safe. 7. Don't let yourself get dehydrated. Dehydration intensifies amlodipine's blood pressure lowering effects by reducing blood volume, increasing risks of orthostatic hypotension, dizziness when standing. Amlodipine's vessel relaxation combined with low blood volume can cause fainting, especially in hot weather, where widened blood vessels and reduced volume amplify risks, particularly for older adults with weaker thirst or kidney function. Exercise, which boosts blood flow and lowers blood pressure, heightening syncope risks. Stay hydrated, especially during heat or activity, and watch for lightheadedness. If symptoms occur, rest, hydrate, and consult your doctor. 8. Don't stop amlodipine suddenly. Stopping amlodipine abruptly can trigger rebound hypertension, where blood vessels overconstrict due to calcium channel upregulation. This can spike blood pressure, risking stroke or heart attack. Long-term amlodipine use increases calcium channels, and sudden withdrawal triggers a calcium surge, causing severe vasoconstriction. Always taper off gradually under your doctor's guidance, typically reducing the dose by 25 to 50% every few days with monitoring. Never stop on your own. 9. Don't double up on missed doses. If you miss a dose, never take a double dose to catch up. This can cause a severe drop in blood pressure, leading to dizziness, fainting, or falls, especially when standing. Amlodipine's long half-life, 30 to 50 hours, ensures a missed dose won't immediately disrupt treatment. Take a missed dose if you remember within a few hours, unless it's within 4 hours of your next dose, then skip it and resume your schedule. If unsure, contact your doctor or pharmacist. 10. Don't use potassium salt substitutes without approval. Potassium-containing salt substitutes, for example, no salt, salt scents, can be dangerous, especially with ACE inhibitors or ARBs, which raise potassium levels. These substitutes, 600 to 700 milligrams potassium per 1/4 of a teaspoon, can lead to hyperkalemia, greater than 5.5 MEq/L, risking ventricular tachycardia, fibrillation, or cardiac arrest, particularly in those with kidney disease. Symptoms like fatigue or muscle cramps can be subtle, so regular potassium monitoring is essential. Consult your doctor before using these substitutes. 11. Don't deviate from your prescribed dosage. Taking amlodipine exactly as prescribed is critical. Too little can lead to uncontrolled hypertension, increasing risks of heart attack, stroke, or kidney damage. Too much can cause severe hypotension, resulting in dizziness, fainting, or cardiogenic shock. Amlodipine's long half-life requires daily consistency for steady blood pressure control. Never adjust your dose without medical guidance, stick to your doctor's plan. 12. Don't fail to inform your medical team before surgery. Always tell your medical or dental team you're on amlodipine before surgery or dental work. Its vasodilating effects can enhance anesthesia, causing dangerously low blood pressure during procedures. Your anesthesiologist may adjust or pause your dose based on your health and the procedure. For dental work, local anesthetics with epinephrine can slightly lower blood pressure, increasing risks for those on amlodipine for angina. Inform your team to ensure safe decisions.